Hi guys, welcome back to Skincare Sunday. Dr. L here at Revital. Today's topic, I'm calling it Beyond Botox 2 because last week I showed you guys my driver's license from 2019 and 2023. Got asked a lot of questions about what exactly happened between those years, and I didn't really cover everything that happened between those pictures because beyond Botox, it's not just what we talked about last week as far as skin aging. We are aging at all levels. So skin aging is really where it begins. We lose collagen, elastin, hyaluronic. Then we go into those fat pads, right? Under the skin, our fat pads are separating, they're changing, they're really losing that voluminous, youthful look. Beneath that is bone loss. That's also happening in the aging process. So if you want to work in a world beyond Botox, reversing aging naturally, working on your skin is great, but you got to look beyond that. So aging under the skin, those changes in volume with fat pads and bone reabsorption are happening pretty early on in small amounts. We don't really see them or notice them till kind of in our 30s. We start to see that we just kind of look more tired and deflated. And what's really happening is that we're going from the triangle of youth in a woman to the triangle of aging. Things are kind of going towards our mouth. We're folding this way, we're separating this way, we're losing our lateral volume. Our jawline is becoming less defined. We're losing that angle. So many things are happening at that volume level that are giving us this tired, saggy, fullness down here look. So addressing volume early on, restoring that natural volume, and restoring that structure that we're losing is a great way to work beyond Botox. So I just want to speak to the ton of anxiety out there about injectables beyond Botox. Fillers are an area where a lot of people don't feel comfortable. They see these unnatural appearances, the pillow face, the bloated look, where people kind of just have like this shelf here or chipmunk look. And it's unfortunate that that's the impression about volume correction because really, if it's done well and if we use biostimulators, products like Sculptra and Radiesse that stimulate our own collagen production and rebuild our lost structure that we are disintegrating from aging and pulling this way, that you can actually give somebody a very lifted and supported and youthful look and just restore what they've lost from aging. And even at a young age, you can correct minor volume changes and keep somebody very naturally beautiful. So what I love to do in my practice, and I really think is important when we're talking about volume and correcting that tired, sagging look of aging or working on early signs of that, is start with the biostimulators. This injectable is a way to stimulate your own structure, your own collagen. And then we go in with the hyaluronic fillers and actually correct deficits in certain areas under the eyes and the under eye hollow, lip correction, chin projection, defining the angle of your jawline and giving you a little bit more projection on the lateral portions of your cheeks. So it's really, really about looking at the anatomy, specifically understanding where aging is happening, how it's happening, and using biostimulation, then using fillers to correct those volume deficits to give someone a restored look, to address minor changes in aging early, to be preventative, and then corrective. We can talk so much more, but it's honestly best to have a consultation. If you are seeing signs of aging, if you don't know what would be best for you, the best approach is to have a conversation about what do you want to accomplish when it comes to aging. Reversing aging at the skin level, you guys, is the best place to start. You just get so much more out of anything you do, whether it's lasers or injectables that correct volume deficits or volume changes that are happening to all of us. Consultation as far as aging, working together, how can we be preventative and proactive about aging and not retroactive and waiting for things to be really, really heavy where a surgical option is really the only way to help. So before the jowl, right, before this heavy sagging, before laxity really takes hold and those volume deficits are severe, acting preventatively. So in summary, in between those pictures, 2019 and 2023, I had a lot of skincare, a lot of skin treatments, a lot of reversing of aging, making my skin firmer and thicker with collagen. And then I also used injectables. My favorite, Sculptra. I use other fillers as well, hyaluronic acid family fillers, to correct volume deficits, to do a natural rejuvenation of my volume, as well as tightening and improving the skin. So that combination is the world beyond Botox, which you guys know I cannot get Botox. And it is the world of where aesthetics is really moving, where we are being proactive about aging and being preventative about aging and helping our patients look naturally more beautiful with time and giving you that confidence and beauty of youthful structure, youthful skin. All right, that is all for Skincare Sunday. See you guys next time.